Hey friends, it is Wednesday the 29th of May and I've just given you guys an update. So I saw the surgeon this morning and that was Dr. McAllister. And while I very much like her, it doesn't sound like surgery is on the agenda. So the reason being, because once you're stage 4, they don't really want to risk it with you, I guess. So they're saying it doesn't add much to longevity to do the surgery. So ultimately I did not get the answer I was really hoping for today. All this really great momentum, kind of feels like we're in another stale point. So just gonna be more time, I guess. Her reasoning is because she's afraid it will bloom elsewhere, even though there is no signs of metastatic disease in my body at the point or at this moment. She's not really willing to do it because it could put too much of a distraction on the immune system and have the cancer spread everywhere. So I'm sure this is coming from experience from her. So she said, if she had been younger and was more naive, she would be willing to do the surgery because she's a surgeon and she does surgery. But I guess she has seen it blossom in too many people before, and it ends up killing them. So she is not open to doing the surgery. And if she was open to doing the surgery, she would only do one mastectomy. She would not do a double. So essentially that would just break it up into 2 separate surgeries. To me, that sounds like a worse idea. But she's coming from experience, so she knows what she has seen. I find it hard to believe that it would cause that much trouble. I would imagine anything would, a good bout of stress, too much time spent on chemo could do the same thing. I mean, we could have it blossom in many ways. My immune system can be distracted many different ways. So I'm super bummed. I was really hoping this was going to be like, okay, let's look at the dates, give it a month and you should be good for surgery. The tumor has shrunk a lot. She was really excited about that. She still thinks there's one portion that's too close to the skin. My whole tumor has been close to the skin, so it is hard to imagine it not close to the skin. But it's not busting out of the skin, which would be a reason to do surgery, as if it's busting out of the skin. Or she gave me the, does it hurt? If it's palliative and it hurts, you can get the surgery. Well, I would say the tumor is not pain-free, but I'm not sitting around in agony from the tumor. So right now I'm not claiming pain, but I may at some point. I mean, I tried to explain to her the injections I've been getting and that that's no walk in the park. And the longer I have breast tissue, most likely the longer I'm going to be doing these injections. So I was really hoping to not have those for too much longer. So I don't know. Once again, we're in a waiting game. So I have to talk to Dr. Hancock on Monday. I'll go down to Atlanta and get his opinion. He is still on the belief that taking out the primary tumor is a good idea. And I asked her straightforward, why are there so conflicting views on this? Why do some doctors believe it's good to take out the primary tumor site and why do others not? And she said, I should have not said anything and let her just answer that. But of course, then I said, is it because they don't see their patients afterward? And she said yes. But that wasn't worded well on my side, and I should have let her come up with the words. Because it's not true. Because to me, a surgeon actually doesn't see their patient very often after, especially with something like this. The surgeon is not the main doctor in the mix. So you get the surgery and they, essentially are not really tracking it after that. So I'm not sure how she has come to this conclusion. She obviously has from her own life experience, and I do respect that. Hancock has also seen a lot of people go through these surgeries. And the thing about that clinic is he does see people long-term because people have to do mistletoe long-term. They're not just doing it for a few months and have to quit because it's killing them. They're doing it because it's keeping them alive. So I've got to pick his brain more. I am leaning on his side on this one because her ultimate suggestion for us was keep doing what you're doing because it's working. Let me just be the first to say, this is not sustainable. I cannot sustain this level of living. I cannot keep doing chemo. I cannot do Herceptin and Perjeta more than a year, at least that I know of. I know it can cause some pretty significant damage after that. You know, I can't keep doing what I'm doing. I can't keep affording mistletoe. I mean, I will keep doing it as long as I can, but it is not cheap and it is out of pocket. So what we're doing right now is not sustainable. And I wish I had made that more clear to her. She had basically said, like, keep doing what you're doing, and if it starts growing again or becomes painful, surgery can be on the table. This just seems really, not going to come up with the right word right now, but miscalculated. It seems like we're not looking out long enough. My only thought is that they truly don't believe somebody with metastatic cancer can survive very long, but that's not true. They can. It happens often, right? There's whole books on these people, spontaneous remissions, but I'm not trying to be a spontaneous remission. I'm just trying to take care of what makes the most sense. To me, I have read that it's a 50% shot of cancer coming back in the other breast. And I said that to her. I said, but what about its return to the other side? Wouldn't we want to take care of that? She said, that's not really how it works. News to me. And if it did, it usually comes back as a different type of cancer, like a different type of breast cancer. Well, first off, as somebody who has over-tested, I have found out that my tumor is heterogeneous, which means it's got more than one type of cancer tissue. So I have circulating ER positive tumor cells, but the tumor biopsies came back HER2 positive, which is the more aggressive one. But the circulating cells, there are still a certain amount of estrogen receptor dominant cells. She suggested I can go on to the hormone blocking drugs, which I don't really want to do. I don't have a hormone dominated cancer. Why would I throw that in the mix and just create joint pain and all sorts of other cascading issues down the road? So I'm just kind of in a middle point here, just trying to think it out with you all. I'm sorry, you're my sounding board, but it just doesn't seem logical to leave the scar tissue, tumor in there. Seems like that's where the stem cells would be hiding. That's all I got. So what we're going to do is not let this get me down, because it did this afternoon. Totally got me down. I went into quiet mode and I cooked myself flaxseed bread, which I've never done, and hopefully it's good. I don't know. I had to distract myself. I was not happy this morning. I feel let down again, mostly by my body, but the system too. So hopefully I will pivot this and I will start looking for another surgeon. I have already called another office because I had somebody else in mind, a female surgeon in town. But I'm not sure how many walls I'm going to hit with this. If this is the new standard of care for stage 4 patients, they don't recommend surgery unless it's, palliative, then I may hit this wall with every surgeon. And I am also very much taking their advice to heart. Like, okay, it could bloom. I certainly don't want that. I tried to explain that I'm not a statistic. I'm not your typical person walking in, thinking I'm going to do surgery and then live on my Western American diet and just heal with some soda. I'm not doing that. I am doing things very different, extremely mindful. And my whole plan was to go down to the clinic, stay, hopefully in the place they put you up and they help you stay for a few weeks for free, hopefully, if I get in, and then do all sorts of different IVs, hyperbaric chamber, that's good for infections, it's also good for cancer, I would probably do all the different wraps and packs, and I would just let the clinic take over and help me heal and keep my immune system on point. Keep doing mistletoe. I just don't think that I'm the statistic. So I just feel like this is dragging it out, and I can already see this bleeding into next year and not having the answers. To me, it doesn't feel right to leave this tissue on here. It is, it's been beat up, and it's not fun it's just not fun to have on my body. I'm not saying having them not there would be a better option. I don't know how I'll feel. I don't know. But having them there certainly doesn't feel right. So I need to follow that. And I need to seek out these other surgeons and see if they feel confident and feel confident as well. And if it feels right, then I'm going to go down that path. It seems logical to me. I'm planning on more than 20 years. I guess if you're only giving me 5 or 10 years, I could see how surgery would probably put me in the grave a lot sooner, But I'm planning on a lot longer. So seems to me like getting them off would make the most sense. But I am open to suggestions. I'm open to anyone's advice. Obviously, I have my own strong feelings on this, and it is my body, and I will make the final choice. But I want to think this through. I'm not jumping into anything. And I guess I've got another round of frickin' chemo to go through. So that's a bummer. I'm going to have to get it shrunk down to almost non-existent to even be considered for surgery. And now it just kind of feels like I'll get to that point, and then they'll say, well, you've had it in your liver. We're not going to risk it. So I don't know. We might hit a lot more walls, but I'm trying to be optimistic and see the big picture. So I'm going to keep doing all the things I'm doing and try to keep chugging along. But yeah, it is this. What I've been doing is not sustainable. So it's not a way to live long term. So we're just gonna have to find another way. So wish me luck. I hope you guys are all doing well. I'm sorry for blabbing on. I'm still very much processing today's appointment. I haven't had a lot of time to put some intellectual thought on it. I haven't researched anything, so I don't have anything to teach you guys today other than, shop around, get your research, and make the best educated decision you can make. And that's what I'm going to do. So I hope you guys all have a great evening, and I'll let you know if anything comes up soon. Otherwise, catch you guys in June, I guess. Bye.